Hello, I'm the pulmonologist. I'm Dr. David. You can just call me Dave.
Okay.
How do you think you're breathing today?
Okay.
All right. Okay, well, I just wanted to run over a few things before we discharge you today. I wanted to specifically talk about your emphysema. So that's a new diagnosis for you. One of the things with emphysema is as we breathe, it's okay for you to get air in, but the trouble is getting the air out. So the airways, we want a nice open airway, but the thing is with emphysema is when you start to exhale, they collapse because your lungs are gradually getting bigger, and then you're air trapping. You're keeping that extra air inside. So one of the things I try to tell people to do is to manage their anxiety. You don't want to get panicky, short of breath. Everybody's had the wind knocked out of them before, and that's a scary thing. But the best thing to do is a technique we call pursed lip breathing. You want to take a big inhale, but you want to purse your lips and make it a nice strong current coming out on your exhale. So I'll demonstrate with it. So you take a breath in, then you breathe out through your mouth, and you just want to make sure that it keeps the airways from collapsing. Because with emphysema, as your lungs get bigger, they're sitting on top of that diaphragm. If you looked at your chest X-ray, which is what it's demonstrating, your lungs are elongating, they're getting longer, and they're getting bigger. So that's one of the things that we have to fix. That's one of the things that we have for you. I'm going to prescribe a couple medications for you. One's going to be duoneb. It's going to be a scheduled small volume neb. You have a home nebulizer. You'll be able to take your treatments at home, at your leisure, at your comfort. And then it's a bronchodilator, so it's going to open up the airways. And the other medication I'm going to prescribe is advair. And it's a corticosteroid, so it's going to relax the muscles. So you're going to have, it's not going to reverse your emphysema, but it's going to make it more manageable for you to be able to live at home, go to the mailbox, get to your car, do your daily activities. So other than that, I think that is about everything I have. We're going to have a scheduled visit with you after your discharge today. And I'll be there to answer any questions. We're going to have a couple more RTs and discharge come in and talk to you today before you leave. But I wish you well, and I hope you get better. Thank you for everything.
Thank you.
Hi Luke, I'm Carrie. I'm the pharmacist. I'm going to be talking about a couple of the medications we'll be giving you today. Just let me grab a couple things. Alrighty. So the first medication that we have prescribed for you, or David prescribed for you, is duoneb. It has 2.5 milligrams of albuterol, which is a bronchodilator, so it opens up your airways. And then it has 0.5 milligrams of advair, which is also known as ipratropium bromide, which you see here. That is just the generic medication name. And it helps keep your airways open. So that's going to help you be able to breathe better, get that air moving in and out. And then I'm going to discuss some of the side effects with you. So duoneb has the side effects of an increased heart rate, which is quite common, arrhythmias, increased pulse, increased blood pressure. Are you diabetic? No, it can cause hyperglycemia, tremors, nervousness. It may cause some insomnia, dizziness, headache, or some nausea. If you have any of these symptoms, just let your doctor know or let the respiratory therapist know, and we will look about getting you into something different. The next drug that we have prescribed for you is advair. It is a discus, so it's a dry powdered inhaler. Very easy to use, easy to take. So I have a fake one here to kind of show you how to do it, okay? And there's a counter here, and when it gets close to 0, that'll mean you need to go get your prescription refilled. So when you go home with this, when you pick it up from home, just make sure you get it refilled before the last 2. And he prescribed 2 puffs for you a day. So what you're going to do is you're going to open it up like this, and you're going to pull it back like this, that puts the medication in that chamber.
Okay.
All right, so then you're gonna hold it like a hamburger, and then you're gonna take a slow, deep breath in with your mouth on this, and then you'll inhale that medication, and then kind of hold it for a couple seconds, and it'll kind of settle in your airways, and then do the once in the morning and then once at night. So then you'll do the same thing at night, and then when you close it like this, it closes it, and then it restarts it for the next one. So as long as you don't push it, you're not wasting the medication, okay?
Sure.
And then some side effects of the Advair is a sore throat, a dry mouth, upper respiratory infection, headache, dizziness, diarrhea, vomiting, stuffy nose, cough, and maybe some sinus pain. And you're not on amiodarone, are you? Okay, because you can't take this and take that.
Okay.
Also, something to do after you take this is rinse and spit, and that's to prevent the oral thrush, which is quite common with this medication, okay?
Okay.
Alrighty, do you have any questions?
Does it taste like a hamburger?
No, it doesn't taste like a hamburger. I'm very sorry. It probably doesn't taste very good, though, okay?
It's okay.
Thank you.
Thank you.
I'm Jeff from Respiratory. How you doing today?
I'm alright.
I'm here just to go over your medications with you real quick. What they prescribed you is duoneb,
Okay.
and what it is, it's going to be a liquid. And what this is small volume neb. And what it's going to do, it's going to break up kind of a liquid and turn it into fine particle gas, so it gets to your airways a little bit faster. So what you're going to do every day is it's going to be prescribed to you 4 times daily. You're just going to open this up and pour in here. And you're going to have a hose that goes to a compressor, and you're just going to turn it to about 8 liters, and it should take about 5 to 15 minutes. And each time you use it, you're just going to dump it out and rinse it out.
Okay.
And with this, it's your Advair, and you're going to do 2 puffs daily. And with this, you're going to take a big deep breath, and you're going to hold for about 6 seconds. And this will be 2 puffs per day. Some hazards with that could be increased blood pressure, headaches, anxiety, anything like that. So if that's the case, you should stop immediately and call your doctor.
Okay.
I'm just going to do a quick assessment for you real quick. Okay. I'm just going to ask you a couple questions. Do you remember how many times you're going to take this daily?
4.
4 times. And do you remember how many minutes it's going to take for this treatment?
5.
5 to 15 minutes, correct. And with this, how many times are you going to do it daily?
2.
2, okay. And then do you remember any symptoms or that can happen with that?
Dizzy thing?
Okay.
Lightheaded?
Do you have any more questions?
I don't think so.
Okay. You have a good rest of your day, okay?
Thanks.
Luke. Hi, I'm Jennifer. I'm with Discharge. How are you doing today?
I'm okay.
Okay. I'm just going to talk to you a little bit about what's going to happen now that you're being discharged. They plan on getting you out here a little bit later today. So with the medications that you've been prescribed and everything, you're going to have a compressor at home, which means that I'll get you in touch with the home care company. I've already started calling around, so we can get you set up with them. They'll bring it to you. They will also help provide the nebulizers and stuff like that, and they'll explain things to you. If you have a problem with the compressor, they'll definitely take care of all of that. You can always call them with questions. And with your medications, I wanted to make sure that you understood they're like any other medication that you go to the regular doctor for. So you have to go to the pharmacy to get them. Your pulmonologist will want to probably have an appointment with you regularly to make sure that they're doing okay, that you're in check, all of that, and he'll prescribe them further out. And then I also wanted to ask you about something called pulmonary rehab. Have you ever heard of that? All right. Well, it's almost like a class you go to where you learn exercises to help you breathe better, to help you feel better, to keep you functioning as high as possible. Would that be something you're interested in?
I don't really like exercise.
Oh, well, this would be really beneficial if you want to think about it. I can give you some information on it, some pamphlets to go home. We offer a really great pulmonary rehab program just so that you don't end up back with us any sooner than you absolutely have to. So do you have any other questions for me?
Are you gonna help me out with that?
Yeah,
Oh.
I am. I'll definitely send you with the number and pamphlets on that. But other than that, all right. Thank you so much.
Thank you.